Assalamu alaikum, my dear viewers, respected teachers, students, and family members as well. And those people who are watching me from Pakistan or from abroad, today the message which I am going to record, that is very short but very informative. So as we know that self-medication, which is nowadays a big challenge for us. For example, we are using certain kinds of drugs and medicines without informations at our home and our medical institution and hospitals and many and more area. So first of all, whenever you are using any kind of medication, any drug, so first of all you will have to ask from the qualified person, that is pharmacist, who is he is a person who is legally and professionally qualified. He is expert of drug. He knows about the overall information of the drug, that in which condition this drug can be used, or in this condition the drug cannot be used. So this is the main issue which I am going to arise certain question. Most of the people, they are asking me a different question. For example, a common person, he don't know about the use of the Panadol, paracetamol, which is a drug of choice for fever. He don't know about a dose, how to use it. He don't know about the overall parameter, overall information of the drug. So first of all, you will have to collect all the information, or you should consult with the concerned person. So we are using certain kind of medications for treatment purposes, but we should also know about the toxicity. We should know about the adverse drug reaction. We should know about the ADR, drug-drug interaction. So there are many and more complications regarding the use of drug. So whenever you are using any kind of drug, any kind of medicine, so first of all, so you will have to consult with the pharmacist. And you should know about the basic literature of the drug. For example, sometimes there are very minor infections, but the people, they are using antibiotics without the prescription of the physicians. So I think there is no need to use antibiotic, painkillers, and many and more for the minor ailments. So there are many examples like benzodiazepine, antipsychotic agents, sedative hypnotics, or antidepressant drugs. But these medications must be used on the advice of the physician. The physician will recommend it, a suitable candidate, a suitable drug. Then after that, you can utilize it, you can use it, like sedative hypnotics. For example, in our society, this problem is very common. So let's suppose I'm using a drug like benzodiazepine or sedative hypnotics, that is citalopram or escitalopram antidepressants. Yes, it is used for the treatment purpose, but we don't know about a toxicity. So you should also focus on the ADR. You should also focus on its adverse drug reaction. You should also focus on its interaction. You don't know about the nature of the compound. You don't know about the nature of the drug. So let's suppose if you are using paracetamol, Panadols. Yes, this is a drug of choice for fever. But the problem is that if it is used for a longer period of time, so, or in case of overdosing, so it will cause hepatotoxicity. It can damage your liver. So there are different parameters like therapeutic index, like drug-drug interactions. And I have seen this practice in our society, especially the women or the female, they are using certain kinds of painkillers for a longer period of time. And then after that, after using these medications or analgesics or antipyretics or anti-inflammatory, so it will cause cascade of reactions. So it will produce other complication rather than its therapeutic effects. So this is one of the major problem. So whenever you have any problems or any complications, let's suppose if you are suffering from a disease, so you should consult with the physician. If I compare the Pakistan with European countries, so in Pakistan there is very wrong practice. There is no proper system which is going here. So in foreign countries, the rules and regulations, so the physician or the doctor who is responsible for the diagnostic procedure, he or she should diagnose the disease. And then the pharmacist is responsible to dispense, to prescribe a medication to the patient. And the nurse is responsible upon the direction of the pharmacist and physician. So he should strictly follow the advice of the physicians. Administration of drug to the different patients. So there are many challenges and many problems in our societies which are already going toward worse conditions. And 2025, in one research paper I was studying there, that in 2025 most of the antibiotic, they will lose its power, its potency, will lose its efficacy. So there will be, as a result of, there will be a drug resistance. So for example, let's suppose if you are using any drug repeatedly, so a time will come, so it will lose its work, it will lose its function, it will lose its efficacy. So it's our core, it's our more an ethical responsibility to bring awareness in this society. It's the responsibility of each and every healthcare provider who is responsible for such kinds of errors. So there is irrational practice which is going here in Pakistan. So how it should, there is no proper implementation. There is law, Drug Act 1976, but it should be implemented. It should be implemented on the peoples. What will be the merits if the pharmacist, physician and nurse, they can work collaboratively? So there will be, definitely, the disease ratio will be reduced. And this is called rational treatment. Rational treatment, it should be continued to the patient. So it is highly suggested to all healthcare providers, so kindly bring little bit awareness in your society. How to treat a patient, how to use medicines, what are the merits and demerits of the drugs or medicines. So we should know about all the protocols. Inshallah, in my next clip, we will talk about the other agents. Thank you so much for watching my lecture.